Start the examination by washing your hands, greeting the patient, and obtaining consent for the procedure. Ensure that the patient is not in any pain, and whilst you are interacting with them at the start of the examination, note any speech problems such as dysarthria, dysphonia, or dysphasia. Check the facial appearance for any ptosis or asymmetry, and look for evidence of dyskinesia. Start by testing the olfactory nerve. Ask the patient if they have noticed any change in their sense of smell. Then test each nostril individually with either coffee or chocolate, asking the patient to identify the substance. Now test the optic nerve. Start by assessing visual acuity, testing each eye separately using a Snellen chart. You should now assess the visual fields, testing each eye separately by confrontation using a red hat pin. Ask the patient to cover one eye, then cover your own, and test each quadrant of the patient's visual fields, ensuring the pin stays in a plane that is equidistant between yourself and the patient at all times. Now test colour vision, testing each eye separately using Ishihara plates. Move on to pupillary assessment. Note size and symmetry. Test the direct and consensual light reflexes. And you should also examine for swinging light reflex at this point. Test accommodation, asking the patient to focus on an object behind you, then on an object close to their face. Now perform fundoscopy. Start by eliciting the red reflex and look for any opacities that will appear dark, outlined by the red glow. Check the optic disc for colour, contour and cupping. You may now assess the oculomotor, trochlear and abducent nerves using the H manoeuvre and stabilising the patient's head gently, placing your left hand under the patient's chin. You should ask the patient to follow your right index finger. Now move on to assessment of the trigeminal nerve. Start with sensation. Assess fine touch using a piece of cotton wool in the ophthalmic, maxillary and mandibular branches. You should also elicit a corneal reflex. Now assess the motor branch. Ask the patient to open their mouth. The jaw would deviate towards the side of a lesion. You should assess jaw jerk, placing a finger on the patient's mandible in the midline and gently tapping your finger with a tendon hammer. This will be exaggerated if an upper motor neurone lesion is present. Now assess the facial nerve, observing for asymmetry, then moving on to assessment of the chorda tympani by using a substance that is either salt, sweet, bitter or sour on the anterior 2/3 of each side of the tongue. Now test the motor branches of the facial nerve. First, ask the patient to raise their eyebrows, then to screw up their eyes against resistance. Next, ask the patient to blow out their cheeks, show their teeth, and to tense and flare their neck muscles. To test the vestibulocochlear nerve, first perform Rinne's test. Place a vibrating tuning fork on the mastoid process to test bone conduction. When the sound is no longer detected by the patient, place the vibrating arms immediately lateral to the ear. Conductive hearing loss may be suspected if the patient is unable to detect the sound again. Now perform Weber's test. Place a vibrating tuning fork on the forehead in the midline. Ask the patient where the sound is heard loudest. A patient with conductive hearing loss will detect the sound loudest in the affected ear. You should also test the oculocephalic reflex in a comatose patient. Now move on to assessment of the glossopharyngeal and vagus nerves. You should elicit a gag reflex and then ask the patient to say "ah" and look for deviation of the uvula that should deviate away from the side of a lesion. Assess the spinal accessory nerve, asking the patient to shrug their shoulders against resistance to test trapezius, and then to turn their head to the side against resistance to assess sternocleidomastoid. Finally, ask the patient to protrude their tongue. This assesses the hypoglossal nerve. The tongue should deviate towards the side of a lesion. Thank the patient to finish your examination.